I chaired a session on novel issues in the combined modality treatment of lymphomas. And the session was divided into two. The first part of the session was extremely interesting because it dealt with the new immunomodulatory treatments, in particular the checkpoint inhibitors, where we have very interesting aspects with regard to the combination with radiation therapy. Because radiation therapy is the most effective way of increasing the antigenicity of tumours. So the combination with the checkpoint inhibitors seems, at least from a theoretical point of view and from experiments in animals, to be a very, very interesting combination, which is now being tested in clinical trials, but we do not have the final results yet. But we went through the different aspects also in combination with chemotherapy in this important area where I expect some very interesting results in the coming years. And the second part of the session dealt with a fairly rare lymphoma, at least in the Western world, the NKT cell lymphomas. They are much more common in Asia, and we have an organization, a worldwide organization, the International Lymphoma Radiation Oncology Group, where we have members also from the Far East. So we took advantage of that and had Professor Yeshong Li from Beijing in China and Professor Masahiko Oguchi from Tokyo in Japan give their view on the treatment of this highly aggressive lymphoma, because they have a much larger experience than we have. And in this type of lymphoma, the combination of chemotherapy and high-dose radiation therapy is extremely important for the outcome. And the chemotherapy is special in this situation because the tumor cells often harbor multi-drug resistance, so it's a special form of chemotherapy where L-asparaginase has an important place. However, this is also very toxic, and the radiation therapy has to be given to large volumes in the head and neck area, so a difficult lymphoma to treat, but we got some very interesting results and guidelines from our Asian colleagues, and we also covered the aspect of this lymphoma in the Western population from a colleague in the US. So these were the important points that we covered in the session on the novel issues in the combined modality treatment of lymphomas on Tuesday.